You've seen the photos, the swollen ankles, the strange bruising on the back of his hands covered with what appears to be makeup. Most people look away. Doctors don't. Today we're going to look very carefully through the lens of internal medicine and cardiology, and what we see is deeply concerning. Let's start with the ankles. Bilateral pitting edema, swelling in both lower legs simultaneously, is not a minor cosmetic issue. It's a clinical sign. In medicine, we treat it as a symptom screaming for explanation. When we see bilateral lower extremity edema in a patient in their late 70s, we immediately run through a differential: cardiac failure, venous insufficiency, renal disease, or hypoalbuminemia. The critical word here is bilateral. Unilateral edema suggests a localized problem, a clot, an injury. Bilateral edema points upward to systemic causes. In cardiology, the most concerning possibility is right-sided heart failure, also called cor pulmonale, or simply congestive heart failure. When the right ventricle cannot pump blood forward efficiently, it backs up, and that fluid migrates into the soft tissues of the ankles and legs. The technical term is dependent edema. It pools where gravity pulls it. Now, Donald Trump has been publicly known to carry significant central abdominal obesity, what we call the android or apple body distribution, with a BMI reported well above 30. This body type places enormous mechanical and metabolic demand on the heart. Over decades, that translates to left ventricular hypertrophy, diastolic dysfunction, and eventually, congestive failure. Now, let's talk about something that has puzzled many observers: the recurring bruising on the dorsum, the back of his hands. Sometimes visible on one hand, sometimes both, and then concealed with what appears to be heavy cosmetic coverage. As someone trained in orthopedic and pain medicine, I've placed more IVs and performed more injections than I can count. The dorsal hand veins are a standard IV access site. Repeat venipuncture, repeated needle sticks into those thin superficial veins, leaves bruising. In an elderly patient with fragile vessel walls or a patient on anticoagulant therapy, that bruising can be dramatic and persistent. What medications warrant anticoagulation in an elderly cardiovascular patient? Atrial fibrillation is the most common reason. AFib, irregular heart rhythm, dramatically increases stroke risk, and its treatment requires blood thinners such as warfarin or the newer agents like apixaban. If he is on anticoagulants, even routine blood draws would cause the bruising we see. The concealment is medically significant in itself. A person who is covering IV bruising with makeup is a person who does not want us to know they are receiving intravenous treatment. If I were the consulting cardiologist on this case, based only on publicly observable signs, my working diagnosis would be hypertensive heart disease with possible diastolic dysfunction, combined with peripheral venous insufficiency and a high index of suspicion for atrial fibrillation requiring anticoagulation therapy. Supporting this, the known history of hypercholesterolemia, the reported diet high in saturated fat and processed food, the sedentary lifestyle, the central obesity, the age, the male sex. Every major cardiovascular risk factor is in play here simultaneously. The edema tells us the pump is struggling. The bruising tells us needles are going into those veins regularly. The concealment tells us someone does not want you to draw the obvious conclusion. In the coming months, here is what a cardiologist would tell you to watch for: increasing dyspnea, shortness of breath, especially during public appearances. Increased reliance on elevators, ramps, or golf carts where stairs once sufficed. Visible fatigue after brief exertions. Changes in skin color, pallor, or mottling. Any sudden absence from public view following a cardiovascular event. These are the signs that the cardiovascular system is losing its battle. And in a sitting head of state, that matters to all of us. Next episode, we move from the heart to the brain. We'll look at gait, balance, and speech, and what a neurologist sees that you probably missed. Stay with us. Learn more about clinical observations and medical analysis on umbedsidemanners.com for entertainment purposes only.